Question 1. Can you tell me about a time when you recognised adverse changes in your patient's condition and how you responded? When I was an enrolled nursing student, I was doing the admission for a gentleman who had a workplace injury and he was going in for emergency surgery. He was sitting in a seat and I was asking him some questions, and all of a sudden he become a little incoherent, seemed somewhat confused. He slumped back into his seat. He just didn't seem right. So I asked him if he was okay, and he responded by saying he just didn't feel well, like he was hungry. I suspected he may be going into shock, so I started to take his blood pressure when he fell unconscious. So I called a Met Call, and the medical emergency response team came in and took over. His blood pressure was very low, hence him passing out, and then he was okay. Question 2. What is work health and safety, and can you give me an example of your application of work health, safety in clinical practice? So in a nutshell, it is risk management of the safety of workers, all customers, so patients, visitors, suppliers, internal and external customers. It is the management and prevention of injury or harm to those people, including myself. An example of that is appropriate manual handling. So in theatre, if a patient is over 100 kilos, we will use a hover mat to prevent injury to ourselves when we're transferring that patient from the bed to the theatre table and back again. Question 3. You have a Muslim woman going to theatre for a D&C post mid-trimester delivery for retained products of conception. As you prepare her for theatre, she refuses to take off her hijab. How would you manage this? As it is a huge thing in the Muslim culture to continue to wear their hijab, and I am an advocate for being culturally safe and making my patients feel like they are culturally respected. I would speak to the anaesthetist and see if it would be okay if she keeps the hijab on, as all patients need to come in with a head covering, a hat on. I couldn't imagine that it would be a huge issue. I would suggest that we may need to loosen it around the neck to allow for safe airway management, but I would discuss with the anaesthetist and try and advocate to allow her to keep that on. Question 4. You have a 12-year-old Aboriginal girl from a remote community on the ward with query appendicitis. The RMO advises that he thinks the appendix has ruptured and she will need to go to theatre ASAP. Her mother has gone to town to do her Centrelink banking and shopping. How do you manage this? Being that she is 12 and from a remote community, I would consider factors such as language barrier, that she is only 12, and I would first try and contact the mother. If I was unable to do so, I would try and contact family members or people from her community. I would also involve the Aboriginal liaison officer and a translator if necessary. I would explain in simple, clear terms what is going to happen and why we're going to have to do it. A ruptured appendix is potentially life-threatening, so it is paramount that she be taken to surgery as soon as practicable. So if we couldn't get a hold of mum, being that it's an emergency, I would involve said community people and Aboriginal liaison officer, but we would have to go ahead with the surgery and then explain to mum on her return why we needed to do it in order to save her daughter's life. Question 5. The boarder of a 6-month-old was admitted to the ward with pneumonia, returns to the ward after an evening off the ward. She appears intoxicated, she has an ataxic gait and smells of alcohol. She picks up her son and breastfeeds him. As you approach, she asks for some sandwiches as she has not yet had dinner. How would you manage the situation? I would very tactfully advise the mum that there is evidence that alcohol will be passed through the breast milk into the baby, and that maybe just for the time being we supplement the feeds. As mum has a gait, my concern would be her holding and carrying the infant in case she dropped him or fell whilst holding him. So I would offer her the food that she has requested and offer to feed the baby for her while she has something to eat, and that at a later date she could then feed the baby after there's been an appropriate period of time in between.